Hi there, this is Professor Papia Bernstein, and this is going to be a brief lecture to accompany topic 3, which focuses on the IEP process and the IEP as a document. And a lot of the information that you will be learning comes directly from your textbook, but there is some specific terminology that I wanted to go through with you when we talk about writing long-term or annual goals and short-term or behavioral objectives. So in IEP language or terminology, we use the terms goals and objectives. You will use terminology in different ways at different times in your career, depending to a large extent on your context or your work setting. So if you're at the university setting, certain terminology may be used. If you're in the school setting, it may be used differently. And if you are in a clinical or rehab setting, it may be used differently still. The important thing to remember is that there is a larger context, and then there is a smaller or more specific context. So in the world of school-based practice and IEPs, when we talk about the larger context, we're looking at the annual goal, or the goal that we would like the student to accomplish during the course of the entire school year. But then we break that goal into various objectives. So the goals are larger and the objectives are smaller. So I'm going to talk specifically about objectives because once the long-term goals have been established, we need to figure out what the smaller pieces are. And we sometimes call them behavioral objectives. And a behavioral objective, it has to be a statement that describes a specific behavior that we want the student to accomplish in observable and measurable ways. And we have to be sure that the terminology we're using is observable and measurable. So there are three main components of a behavioral objective. There's the action statement, or the actual behavior, or we sometimes call it the do statement. There's a condition, which has to do with the context for that behavior, and then there's a criterion for achieving that behavior. So again, the do statement identifies the action that we are expecting the student to perform. So this part of the statement really contains the verb that has to denote some type of observable activity. So we need to avoid using non-action types of verbs. So for example, a verb like say, label, repeat, name, tell, all have or might have an observable component. But when we use other types of verbs like understand, think, improve, there is no implicit observable component. One easy way to check the appropriateness of the verb is just to ask yourself, will I be able to count how many times this behavior occurs? So for example, if you want the student to repeat single syllable words or one syllable words, the number of repetitions will be countable. If we want the student to learn single syllable words, it will not be countable. So let's now talk about the condition. The condition identifies this type of situation in which the behavior is to be performed. So we specify perhaps when or where. We like to tie it in with the subject area or the curriculum area now. We also can talk about using what methodologies or what activities or what materials or what types of cueing devices. This is all part of the condition. So it might be statements, we might use statements such as given the clinician's model, or in response to a question, or during a vocational activity, using pictures and carrier phrases. These are all part of the condition. Let's move on to the third variable, which is the criterion. The criterion specifies how well the behavior is going to be performed for the objective to be achieved. We can look at it in a number of different ways. We can look at it in terms of percent correct. We can talk about within a specific time period. We can specify minimum number of correct responses. We can talk about the maximum number of error responses. Some of the more common criteria that have been used are percentages like 80 or 90%, or 8 out of 10 trials. We can say 75% over 3 consecutive sessions. Okay, so an example of a behavioral objective might be the client will use a slow rate of speech, such as 4 syllables per second, with 85% accuracy or better, while reading single sentences over 2 consecutive sessions. So that kind of thing would contain everything. We have some examples of statements that are not complete objectives. For example, student will produce several times given the clinician's model. This, if you were to analyze it, does not have any way of measuring the criterion, because several times is not specific. A client will use regular past tense with no errors. This is also not specific, and it also has no context. It's unlikely, even though it says no errors, nobody really, we don't go for 100% correct productions. It's very unusual to get that when you're in the process of therapy. Client will produce is plus verb plus ing with 80% accuracy. There's absolutely no context, no setting there, no conditions. Okay, so you can kind of think about this, and I will probably see you again later. Bye.